Well, high burnout rates among nurses during the COVID pandemic led to our country losing more than 100,000 nurses in 1 year. That was 2021.
In fact, that is a far greater drop than we've seen over the past 4 decades. Kirsten Joyce reports on new research that shows what kind of changes need to happen to help our nurses' well-being and also because of post-COVID.
Robin Wubenhorst is a labor and delivery nurse in Southern Nevada with 12 years experience in a career that she loves.
This is an amazing opportunity for men and women. It gives you so much flexibility where you're not working 5 days a week. You're working, like I said, for the most part, 3 days a week in a hospital.
But her profession during the COVID pandemic would place her in situations with excessive on-the-job stress, well-founded fears of becoming infected, and profound grief over seeing patients pass away to COVID-19.
During the pandemic, it was just so incredibly scary taking care of some of these patients. It was just a horrific fear on the staff's point of view because things were changing on such a rapid daily basis.
Plagued by guilt when the mass sick calls started coming in, torn by her own personal exhaustion and not wanting to let the community down.
I think everybody's just scared, like, what if that happens again? What if there's another pandemic? It happens again. And I think this is, hopefully for all of us, this is a once in a lifetime situation.
There are problems in the system.
Problems Michelle Larkin says were exacerbated during the pandemic.
Physical abuse, bullying, staffing ratios that don't allow nurses to provide safe care for the based on the complexity of the patients that they're caring for.
Larkin is tackling our nation's toughest healthcare problems with her role at the Robert Wood Johnson Foundation. For various reasons during the pandemic, our country lost more than 100,000 nurses. Now the foundation says there are key steps to refilling those roles, including taking care of nurses' health and well-being.
Some of the things that are showing up in the report around employers is that they can design mechanisms for nurses to be able to report unsafe working conditions.
Encouraging a culture of safety, which Robin says starts with making yourself a priority.
A nurse really needs to cultivate herself as far as like mental health and physical health. You have to take care of yourself in order to take care of your patients.
Kirsten Joyce, 8 News Now.